In this video, I'm going to share 4 baby toys which can lead to developmental delays if they're overused. And overused is not as long as you might think. These toys should only be used for an absolute maximum of 10 to 15 minutes per day. And on top of developmental delays, they also pose safety risks, which is something you should consider as well when deciding whether or not to use them. The first toy is one that you might not expect. It is the baby floor seat. Baby floor seats are small devices which support a baby to sit up before they're capable of sitting independently, and typically they're used by babies who are around 3 to 6 months of age. Baby floor seats are often promoted as a means of teaching a baby how to actually sit. However, they don't really help babies learn the skill of sitting, nor do they actually speed up that process. When a baby is sitting in a baby floor seat, they are passively placed into the sitting position and then essentially locked into this position. And that's because the equipment itself actually holds them into this sitting position by providing really firm support around their hips and their trunk muscle. And this snug fit eliminates the baby's need to actually turn on their tummy and back muscles to sit upright, which actually stops the baby from being able to build that trunk control and pelvic stability, which is required for them to learn to sit independently. Furthermore, when babies are placed in baby floor seats, they're unable to move from side to side or backwards and forwards, and this prevents them from being able to develop that dynamic sitting balance which is required for a baby to sit up independently. Additionally, baby floor seats can also potentially increase the risk of a baby developing hip dysplasia, which is basically hip dislocation or a partial hip dislocation. And this is because when a baby sits in a baby floor seat, their legs are encouraged to come together and adopt a straight-like position. So they go straight in front of their body. Now, this position is actually a known risk factor for developmental dysplasia of the hip or that hip dislocation. Instead, we want our babies to be adopting a healthy hip position where their hips come out to the side and their knees are bent up in an M-like position, which isn't something they can achieve when they're using a baby floor seat. Furthermore, there have also been cases of babies sustaining injuries, including skull fractures, when they're using baby floor seats. In fact, there have been cases where infants as young as 3 months of age have fallen or escaped from a baby floor seat by arching backwards, leaning forwards or to the side, or actually rocking in that floor seat. Also, the risk of injury is higher once a baby is able to independently sit up and they're still placed in a baby floor seat as a way to keep them in one spot, because these children are a lot more mobile and they will try and get out of the seat by simply moving, and that can result in them falling. Now, before we cover the second toy that places a child at increased risk of injury and developmental delay, if you haven't already, make sure you click on the free developmental checklist in the description box below, which will give you invaluable peace of mind as you'll know when to be expecting milestones and when to be concerned. Now, the second toy is baby jumpers or bouncers. Now, baby jumpers or bouncers are designed to allow a baby to bounce by using their toes to push off the ground. And unfortunately, while babies tend to find this motion extremely enjoyable, baby jumpers can negatively affect a baby's development and place them at risk of sustaining injuries. So firstly, let's talk about the developmental impact. Babies are often placed in baby jumpers from 4 months of age and up. Now, generally until 8 to 9 months of age, babies do not have the strength or muscle control to stand up, let alone control their body movements when they are bouncing quickly. And because they don't have these skills, when using a baby jumper, babies will lean forward into the slung seat rather than standing upright. Now, standing upright is the position we need babies to adopt when they're learning to stand up and walk. Furthermore, baby jumpers teach babies to stand up and push up off their tippy toes, and regular use can actually encourage them to have pointed toes all the time. And this can lead to shortening of the calf muscle, and in extreme cases can result in babies needing to have serial casting to actually lengthen the calf muscle or surgery. This learned movement of being on their toes is actually counterproductive to the heel strike action that's required for independent standing and walking, and therefore can delay the development of your baby reaching these milestones. Also, when a baby is under 6 months of age, their hip joint is still developing, and during this stage of hip development, it's really important that babies are allowed to adopt a healthy hip position, which simply means that their legs should form an M or frog-like shape. And unfortunately, when babies are using a baby jumper, their legs are suspended and straight. And this is an unhealthy hip position, and it can increase the risk of abnormal hip development, including hip dysplasia or hip dislocation. When using baby jumpers, babies have actually sustained limb and head injuries after falling from these devices, and this was due to lots of different reasons. It was the door clamps breaking, the laces snapping under tension, the baby was not securely strapped into the harness in the first place, or other siblings or pets rush past the baby when they're in the baby jumper and accidentally push them into the doorway, and this caused an injury. There have also been cases where babies have actually injured their fingers because they've become trapped or pinched in the springs and chains of the baby jumper. Now the third toy is an exercaucer. So an exercaucer is a stationary play center that has a slung seat in the middle to support a baby while they're either standing or sitting. Now depending on the exercaucer being used, the baby's feet may directly hang and rest on the floor, or they might rest on a saucer-shaped bottom. Exercaucers are marketed as a toy which will help to strengthen a baby's leg muscles so that they can actually learn to stand independently. But unfortunately, this isn't true. And this is because babies are usually placed in exercaucers before they can actually stand up by themselves, because once they can stand, you obviously don't need this piece of equipment. And when babies are placed in exercaucers before they have the strength to stand independently, instead of standing upright, the baby will actually fall forward and rest their tummy on the front of the slung seat. Now this results in their hips tilting forward, and as a result, they need to actually curve their back backwards to actually place their head and shoulder behind their hips to then play with those toys. And as their legs are not yet strong enough to support their body, they generally lock their knees. Now this position of locking one's knees and bending forward at the hip, then backwards at the back and shoulders and head, is the total opposite position your baby needs to be in to stand independently. For a baby to actually stand up independently, their feet need to essentially be directly underneath their hip, and their hip needs to be in a neutral position rather than tilting forward. So it needs to be in a neutral position, and their shoulders and heads are generally stacked above their hips. We do not want a child to be leaning forwards or backwards when they're in standing, because this will just lead them to falling over. So as you can see, the position a baby adopts when using an exercaucer actually encourages poor alignment and may result in the baby developing an abnormal way of moving, which will make it more difficult for that baby to learn to stand and walk. In addition to potentially delaying a baby's development, a baby is also at risk of falling out of or climbing out of an exercaucer and injuring themselves. And the fourth toy is a baby walker. A baby walker is a toy that babies use to move from one place to another before they're able to walk. Baby walkers typically consist of a circular frame which has a slung seat in the middle, which holds the baby in standing and allows their feet or toes to touch the ground and propel themselves forwards. Now this might sound great, but baby walkers are simply not safe. Baby walkers allow infants to move quickly around the house and grab things that are normally out of reach. An infant in a baby walker can actually move more than 3 feet or 1 meter per 1 second. And due to the sheer speed infants are able to move, parents are simply unable to respond quickly enough to actually prevent injuries. In fact, most baby walker injuries happen while adults are watching. The most common injuries babies sustain when using a baby walker include head and neck injuries. So these include skull fractures, brain injuries, bruising, cut lip, tooth damage, cut tongue, or skin abrasions. Children have also sustained burns and scalds when they've reached for hot drinks, kettles, heaters, ovens, or open fires when they're in the baby walker. There have also been incidents of choking after a child has been able to reach a toy which they wouldn't have been able to reach unless they're in the baby walker. Children have also sustained finger and toe injuries or breaks from when the baby walker themselves have collapsed. And lastly, there's been incidents of poisoning when the baby has actually reached for cleaning or bathroom products or medicine, which they wouldn't have had access to unless they were in that baby walker. In addition to the safety risks associated with using baby walkers can stop a baby from learning the proper mechanisms for walking. When using a baby walker, babies sit in the slung seat and move the baby walker essentially by leaning forward and using their toes to scoot along the floor. Now this position is actually strengthening the wrong muscles required for walking. To stand and then walk, babies need to learn to stand upright, not forward, and they need to walk on their feet, not on their toes. The American Academy of Pediatrics has actually clearly stated that baby walkers do not promote independent walking and stress that baby walkers can actually delay normal development and motor control. As baby walkers do not provide babies with any developmental benefits and they actually increase their risk of sustaining quite serious injuries, the American Academy of Pediatrics has actually recommended the ban of manufacture and sale of baby walkers, and Canada themselves have actually gone one step further and actually banned the sale of baby walkers since 2004. Now, if you do want to buy a toy to help your baby learn to walk, then what you want is actually a baby push walker. And what you need to do is watch this video next to find out exactly what a baby push walker is and how it's very different to a baby walker, as well as how a baby push walker will help give your little one the confidence and build their muscle strength and coordination required to walk, and most importantly, let you figure out which baby push walker is going to work best for you and your baby.